I just want to answer this question. Please remember, this is just my personal opinion. I'm not a professional. I didn't try all surgeries. I just had one, which got me with a form on ENS for about 15 years. I will tell you just my simple opinion from what I read, from what I think. And also, please watch the entire video. I'm going to add some other important things because in my opinion, turbinate of any kind of surgery on turbinate and perhaps even septoplasty, it's really the last thing to risk. If it goes bad, you will have a different life from that point on, and just be aware. So my take on this is, first, it's very important. I cannot stress this enough. You don't believe it until it happens to you. Be aware that many doctors are not what they appear as a persons at the personal level. Many just don't tell the truth. So I'm warning you. I'll explain more in a moment. My take on this would be to do, if you really want, only one nostril. So the nostril, either left or right, that appears to be more blocked or blocked. If it's possible, skip the surgery altogether if you can still breathe reasonably well. If you are just not happy, you think you can improve your breathing, don't try this surgery, don't risk it. It's the risk, it's just too much, no matter what doctors will try to tell you. So only one nostril, by any means, no damage, cut, removal of any amount of the mucosa that's on top of the turbinate. So basically you have kind of a bone which is not strong like a bone, it's really kind of flexible bone if you want, like a sponge. And on top of this bone you have sort of a skin, just like your skin. It's called mucosa. It has to be very wet. It's not like your skin, but something like this. So no cut, removal of any amount of mucosa, and I'll explain one important thing in a moment. Make sure the doctor only makes a hole through the front of that mucosa, so a tiny hole, and then they have long tools, thin tools, just like needles if you want, that they insert through that hole, and then underneath the mucosa, without damaging the mucosa, they remove a small amount of the bone itself, the spongy bone if you want, the turbinate. So, okay, you got the point about the mucosa part. Strictly no damage to it, only a tiny hole because they must go underneath it. And for the turbinate itself, usually doctors will work on the lower turbinates. You have three of them on each side, 1 to 3 on each side. The lower one, it's the biggest one, and that's the one they want to reduce. No more than 30% reduction, again, only on one side. 30% maximum reduction of the lower turbinate. The technique I don't know to recommend. Perhaps the doctor can explain you. I don't really know the names for the techniques. I can just tell you that although some websites, some blogs on internet say that radio frequency is safe, I got several persons on my YouTube commenting, the actual persons commenting saying that they had radio frequency and got empty nose syndrome. So don't trust everything you see. Okay, so to sum it up, only one nostril, only no more than 30% reduction of the turbinate itself, and absolutely no damage to mucus. Now, let me just add several other things. Hopefully I don't forget a few of them. First, like I said, not just my experience, please read my comments and read comments from other videos. Many of these doctors are really very not openly going to tell you first the secondary effects. They will tell you it's either empty nose syndrome either doesn't exist or it's very small amount of person, blah 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 blah. You believe them until you get it. Second thing, I had several of people who had surgery. The doctors didn't tell them exactly what they were doing. That's exactly my case. So there is a good chance there is a doctor out there that will tell you, I'm not going to touch the mucosa. I'm just going to reduce a little bit of amount of turbinate. And when the surgery is done, you are going to find out he did completely different things, much more damage, if you want, that what he told you in person. So at least maybe if you are in the United States, have the doctor write on a paper exactly what he is going to do, everything complete, and sign it. You are at least happy in the United States. I think you can sue them if it turns out they did something else. I know in Canada this doesn't work, many other countries this doesn't work, but at least if the doctor doesn't want to write it down, or if he says like, why don't you try, there is a door to that office, walk away, please. That's all I can tell you. It's up to you to trust someone. Be aware, a doctor can be also a very nice talking person and try to tell you good things. You are a beautiful lady or so, try to kind of manipulate you. You are just aware, right? One other thing is that I had people who had doctors telling them they are going to do only septoplasty, kind of moving, if you want, shifting the septum, the cartilage only, or maybe even sometimes cutting into it. I don't think it's a good idea to cut into the septum, but some people actually, on top of the septoplasty part, they also got turbinate reduction, which the doctor didn't tell them. It's all about geometry inside your nose, right? Figure out is like more or less two tunnels, two holes, right? So the doctor is really playing with geometry, and they are really, I think some of them really eager to make the most space they can do inside, which obviously turns into removing most parts and damaging more, creating more damage. They just maybe want some of them just removing everything they could do just to be sure they get a result. Don't do that. Okay, you have a very long time in your life to reflect about the outcome. So just like I said, try first a small amount. Don't try to get 100% results, maximum results, just like we do with everything these days. You want that phone that has even more whatever camera pixels or resolution or whatnot. Don't do that with your nose. It's not reversible. You only have one life, right? And don't get into this problem. One thing, so I don't forget, is actually there's two things. There are situations when the mucosa, not the turbinate, but the mucosa does overgrow, does get thickened. Obviously, it's going to obstruct the nose. This oftentimes happens when a child, for instance, or even perhaps a teenager or even a toddler, a baby if you want, will just fall maybe face first on the floor, or maybe hit a wall, or someone will punch that person in the face. Accidents. Parents oftentimes don't even are aware of what happened. The nose will be broken at that point. The bones of the nose, maybe look, I have another video explaining this. The nose will shift one side, which at that moment of that age of the person will cause an enlarged nostril. When this happens, when one nostril is enlarged because the nose has been broken, this person will keep growing, right? I was saying toddler, child, even teenager. So they will, the geometry, the body will keep kind of growing. The nose will keep enlarging, just normally, normal anatomical growth. But because one nostril will be detected by the body, that's how the body will react. The body will actually try to reduce the space created by the broken nose inside the nostrils. And what happens in these persons, only on the enlarged nostril, the mucosa will actually overgrow more than in a normal person. This is really a normal body reaction. But this overgrowth of the mucosa will cause a blockage actually. So it goes from too large, the body will try to kind of adjust this, and then it arrives actually as too small passage of air after several years of growth, when the person will finish growing their body at around 18 years old or so. So this is one of the reasons why people may go to a doctor one day when they are adults, say, I just cannot breathe with one nose. Okay, so this is one problem here, because basically you just don't want to remove mucosa material, because the mucosa, like I explained in other videos, it's a very fine web of a lot of blood vessels. If you cut into this, if you make a cut, or you just even remove part of it, you just sever these vessels, and the blood can no longer really, just imagine, just like a labyrinth or so, like a web. The blood has to circulate inside this web freely by a pattern, if you want, right? It's just like the streets in a city. It has to flow everywhere. That's what makes the mucosa wet, and that's absolutely critical for the air that you inhale that gets inside the lungs. The mucosa is actually humidifying a really big deal, this air. That's the normal body anatomy. If you cut or remove a part of this mucosa, you sever those tiny vessels. You no longer have that irrigation. The mucosa starts getting dry, and then the happiness of empty nose syndrome starts. Okay, you know now these things. Don't wait for a doctor to explain this to you. Like I said in another video, too many of them are just simply making money, right? Business. So just be aware. Some may be honest. I'm not saying nobody is honest, but be prepared. Okay. So all this to say that I don't know what to suggest if you have a overgrown or thickened mucosa. Ideally, before you think of any turbinate reduction surgery, which I know is cheaper and faster, ideally will be to replace your nose bones, reshape your nose. That's called it's just a nose job, nose surgery. Okay, so that's more expensive. It's more, if you want, traumatic. It's a bigger surgery, but ideally that would be the best thing. And even if you replace your nose, if you have a mucosa that has overgrown, that is thickened, then imagine it's in the nostril that was previously too large. If you reshape your nose, then that nostril will just get more blocked, actually. If you put back your nose in shape, the nostril with the overgrown mucosa may even get more blocked than before. So then you get into another problem. I don't know what to say about that situation. Maybe a 30% turbinate reduction on that side will help, but I cannot tell more. So these are my suggestion. I had other question in my videos if I tried implants. I did not. From what I understand, implants will just kind of rebuild the natural airflow restriction in the nose. So there is a restriction in healthy persons, right? It's not like an empty hole. It's like a shaped geometry inside, and perhaps some implants may partially, don't expect miracle, just help you when you breathe in through your nose, just feel more normal, more. So there is normal restriction in the nose, and you feel the breathing is more normal. But from what I think, just a guess, turbinate reconstruction with implants does not give the mucosa the humidity if you lost it. If it's dry, the mucosa is dry. That I don't see how it's going to bring the wetness of the mucosa back. Then there is the second question about stem cell therapy or so. I'll let you just search about this. From what I understand, first in United States, I don't know what's happening in Canada, but in United States, this kind of therapy is only approved by FDA for very specific treatments. I think one treatment has to do with blood cancer, if I remember well, but there is no approval treatment for empty nose syndrome. There are clinics which do some sort of a shots, injections, if you want. I believe in Bulgaria and other places. From what I read on internet, there are a few people who say that they got some help. I mean, they did feel an improvement from this stem cell therapy. However, one important part is to notice that these people, at least the ones that report, only had only 30% turbinate reduction, no more than that. And I don't know if they got a dry mucosa or not. Perhaps they did from the surgery. So they say there is an improvement. Now, is that, I don't know. I'd like to believe that. I like to believe them. I know this kind of reportings online. Um, I just want to keep a little bit of skepticism. Why? Because hopefully they are real persons who are describing this. Hopefully they are pretty honest, although it's hard to tell when someone is describing an improvement what really that means. Is really like, I like to think in percentage. Is that 50% improvement, 30%, 40, 70, 80? It's hard to tell, right? So there are no studies that really quantify this. So I think it's, some people really go for this therapy, stem cells therapy. Perhaps they have some sort of courage and just try to basically out there. It's up to you. It's up to everyone to try this. Again, you may not. So I'm not sure. Perhaps even in the United States do so. It seems it's fairly expensive treatment. There are, from what I've seen, 2 or 3 shots at distance. So sometimes people strangely say, I don't understand this. They say they do some additional separate treatments, not the shot itself, not the stem cell itself. They say they get some other products, medication or so. I don't know about this, search online. Again, I was saying in Europe, I think someone did this in Bulgaria, perhaps, and he said it did cost about 11,000 euro, the treatment, and several weeks stay in Bulgaria. So it's really up to everyone. If you still have the energy to try this, for me, it's just even traveling to a different country by plane. I don't think I could do it because I have other problems, which I explain in my videos. But it's up to everybody to take a risk or take a chance, or just, if it's the only thing, go for it and try it. I don't know what to say. Just, if it's the only option, then make your decision, basically. But again, just wanted to point this out, that I didn't try this. I didn't try implants. Even if there was a clinic by my door, and if there was, let's just say, free, and if there was a doctor that I would trust, um, I, I, I don't know. I don't think I would try the stem cell therapy. I just could not handle, not necessarily another failure, but I just could not handle another stress and another, I don't know, potential trauma. Even for the implant parts, I think I could not take more. Let's try this. No, it's just my point. But this is really personal, right? I can tell you this has been going on for me for about 15 years now. In my first, perhaps 10 years or so, 8, 9 years, I still had some energy to me. I could still even go to work 8 hours, normal shift job a day. But at this point, there's too much wear to me. If you add the sleep part and other things with my body. So for me, that's just my answer. Okay, so let us know in the comment section if you have questions. Sometimes I can answer, sometimes just give an idea. I'm not a doctor in any way. So just hopefully this gives you some answer. Thanks for watching.